right, welcome to another deep dive. We're tackling a tough one today, folks, a really heartbreaking case study in elder care.
Yeah.
It's about Sally Brown, a 79-year-old woman who passed away in a nursing home.
Mm-hmm.
And her family had some serious concerns about the care she received. So we're going to examine those potential risks of dehydration, malnutrition in nursing homes, and even more important, I think, is what you need to know to make sure your loved ones are safe and getting good care. And to help us unpack all this, we've got an expert here in long-term care and medical record analysis.
I'm saying, glad to be here.
Sally's story is one that it's not unusual, sadly.
Unfortunately not, no.
It really shows how important it is for families to be informed and proactive when it comes to loved ones in nursing homes.
Right, you got to be involved. You got to know what to look for.
Exactly. So let's dive into Sally's story. We've got her medical records here, and we've got some expert analysis to guide us.
Okay.
So can you give us just a little background on what was going on with Sally?
Sure. So Sally ended up at Healthy Place nursing home after her husband passed away.
Okay.
She was 79. She weighed 120 pounds and was 59 inches tall.
Okay.
Now, health-wise, she had a history of depression, congestive heart failure, and dysphagia, which is difficulty swallowing.
So she's got a few things going on.
Yeah.
And I know from the records that her daughter Lisa was really involved in her care.
Oh, yeah, absolutely. Lisa was very concerned about her mom's well-being, and she even paid extra for a feeding assistant to help Sally at mealtimes.
So she had some additional support in place.
Right.
What were the doctor's orders for Sally when she was admitted?
So the doctor ordered a daily diuretic,
Okay.
which is a medication that helps remove excess fluid from the body, but that can actually increase the risk of dehydration if fluid intake isn't carefully monitored.
Right, right.
There was also an order for a high-protein supplement twice a day, to try to help with her nutritional needs.
Okay, so the doctor was aware of the potential for both dehydration and malnutrition.
Yeah, it was on the radar.
Was anything in place to address Sally's depression, though?
That's a great question.
Yeah.
And it's one that Lisa brought up as well.
Okay.
Interestingly, there was no mention of an antidepressant in the initial orders, even though Sally had a history of depression.
That seems like a pretty significant oversight.
Yeah.
And I understand from the records that things went downhill, and they went downhill pretty quickly for Sally.
Yeah.
Can you walk us through what happened?
Sadly, yeah. Despite having that feeding assistant, Sally's health deteriorated fast.
Mm-hmm.
She lost a startling 32 pounds in just a month.
Wow, that's over 25% of her body weight.
More than 26%.
That's alarming. What were some of the signs that she wasn't doing well? What was Lisa noticing?
Lisa started noticing those kind of classic signs of dehydration.
Yeah.
Things like dark urine, decreased urine output. And then she was confused, had a fever.
Those are serious warning signs.
Oh, absolutely.
So what happened next?
So within 5 days of those symptoms showing up, Sally was in the hospital. And she was diagnosed with severe dehydration, acute kidney injury, a UTI, and aspiration pneumonia. It was just this cascade of complications.
Wow.
And tragically, she passed away soon after.
Oh, that is just heartbreaking. I can't imagine the pain and confusion Lisa must have been going through.
I can't either.
And that's really what brings us to this deep dive, right?
Oh.
Lisa wanted answers. She wanted to know if the nursing home could have prevented this.
Right. Lisa felt that something just wasn't right and that she deserved to know what happened.
Yeah.
So she contacted a lawyer who brought in a legal nurse consultant to go through Sally's medical records.
And this is where things get really interesting. And I think this is an important part for our listeners because having an expert, like a legal nurse consultant, can make all the difference.
Oh, for sure.
Can you explain what a legal nurse consultant does and why their input is so important?
Sure. So a legal nurse consultant, or LNC, is a registered nurse, but they also have specialized training in the legal side of healthcare. They're basically medical detectives,
Yeah.
trained to spot inconsistencies, things that deviate from the standard of care, potential red flags, things that someone without a medical background might miss.
Mm-hmm.
They're really good at reviewing medical records, connecting the dots, seeing if there were any missed opportunities or lapses in care.
Right. And they were brought in Sally's case, to go through everything with a fine-tooth comb.
That's right.